founder executive member of ROGS, executive member of IMS Raipur chapter, and past treasurer ROGS. Welcome, Dr. Avinashi.
Thank you, ma'am. Thank you so much for your kind words. It is always a pleasure to be in the hometown and to be back with you. At the outset, I would like to thank Dr. Asha Jain, Madam, Dr. Shalini, and whole team of IMS for giving me chance to speak in front of all you. First of all, collagen. Collagen is the thing that is most abundant structural protein in the human body, and it is a major component of the extracellular matrix, which gives strength, support, and elasticity of the tissue. And it is the most important part that is depleted during the menopause, but it started to deplete by the age of 25. So, as early as 25, you have to take some precaution in your diet, and you have to start taking the collagen for supplementation. So, what are the types? There are four types that constitute different part of the body. Type 1, it is the main component of skin, bone, and tendons. Type 2, it composites the cartilage. Type 3, skin, blood vessels, uterus, and ball. And type 4 is the basement membrane. And they are very essential to maintain all these body parts. So, why it is important for menopause? Collagen is the highly relevant in menopause because estrogen has important role in maintaining the skin thickness, elasticity, and hydration and connective tissue integrity. So, as we reach menopause, the depletion of estrogen affect the quality of skin. So there is reduced collagen synthesis. The skin will become dry, wrinkled. There will be laxity and joint discomfort and genital urinary tissues changes and bone loss. So we have to counsel and we have to explain कि it is just a substitute and but it is not the core management of menopausal management. So what are the collagen supplements available? The collagen supplements, they are from bovine source, uh, porcine source, marine and chicken sources are there. They are hydrolyzed collagen peptides, and they include gelatin and other denatured type 2 collagens. And they are used for skin hydration, reduction, hair, nail health, reducing the joint pains and osteoarthritis symptoms, improving the bone health, and most important tag is for anti-aging. What is the scientific basis behind the collagen supplementation? Oral collagens, they are peptides digested into the amino acids and small peptides which acts as a blocks and may stimulate the fibroblast and produce collagen, elastins, and hyaluronic acids. They improve the skin hydration and elasticity. So, who are the patient who can consider and for what symptoms? The goal of the collagen supplement is to improve the dryness, fine wrinkles, elasticity, to elevate the joint symptoms, pain, or improve the bone health after menopause. Especially, there are some evidence that when they are given with calcium and vitamin D with exercise, some bone health or DEXA base assessment, they improve. They help in hair fall, hot flashes, and vaginal dryness and mood swings. But but what of the collagen? They are the best. For most women, the choice is hydrolyzed collagen peptides, and for joints, they have to choose type 2 collagens, and that is the best thing. What is the dose? For different symptoms, the dose differs. For skin, the dose is 2.5 to 10 gram per day. That has to be taken for 8 to 12 weeks. For generalized menopausal or skin symptoms, only 5 gram per day is adequate. For joint symptoms, 5 to 10 gram. And for bone health, 5 gram per day is good. When to take, it has once day dose is available, and it can be taken in the morning. It has to be taken with meals, and evening acceptable, but there is no special advantage. So once a day it has to be taken with in liquid form, along with dietary protein and vitamin C is to be added because it facilitates the absorption and its uptake. You have to assess because it is time limited trial. For skin, you have to assess after 8 to 12 weeks. For joint, after 3 months. And if there is no benefit or if there is any side effect, you have to stop. If there is benefit, you can continue with the same collagen. What are the common hypes? These are the common hypes. It regenerate, menopause. It is anti-aging miracle, but it has some limitations. It prevents osteoporosis. It cures arthritis or joint pain. Improves the hair growth. Again, there is some evidence, but it is only supplement. It does not replace the main treatment. You have to take the treatment for that symptom. It is only a symptomatic relief is there. So you have to consult, you have to validate. Yes, you can take, explain what is collagen. It may help or it may not treat some symptoms. There are practical doses, further doses, and when you have to take, and you have to reassess the time limit, and you have to counsel about the safety counsel because it may cause allergy, it can cause bloating, nausea, constipation, bad taste, allergy or rashes, so it has to be taken with caution. Essential counseling, again, it is not the main core treatment, it is only symptomatic. So, collagen may support the skin and joint health, but it should not delay or replace proper menopausal assessment, osteoporotic prevention, lifestyle modification, or medically indicated treatment. So, in the last, the greatest wealth is health, and menopause is the perfect reminder to nourish your body from inside to outside. Thank you so much.
Thank you, Doctor, for meeting. So now